Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 1 Bundle podcast, which gets you all of Crush Step 1 and our Step 1 Question podcast combined and ad-free. You'll also get early access to new content as it becomes available. Upgrade your studying now and learn more at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 Questions podcast combined and ad-free. You'll also get early access to all of our Step 2 Questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 1 Questions podcast. In this episode, I'll be reading 3 microbiology questions, and as always, you can read these questions and more on our website at medprep2go.com. With that being said, let's get started with question 1, Microbiology 34. A 19-year-old college student presents to the Student Health Center with a 2-day history of sore throat, fever, and fatigue. She reports difficulty swallowing and swollen glands in her neck. Vital signs show a temperature of 38.5 degrees Celsius or 101.3 degrees Fahrenheit. Physical examination reveals exudative tonsillitis and tender cervical lymphadenopathy. A rapid strep test is negative, but a throat culture grows gram-positive cocci in chains, which are beta-hemolytic on blood agar and bacitracin sensitive. Which of the following is the most likely causative organism? Is it A, Arcanobacterium hemolyticum, B, Corynebacterium diphtheriae, C, Streptococcus agalacti, D, Streptococcus pneumoniae, or E, Streptococcus pyogenes? And the correct answer is E, Streptococcus pyogenes. The presentation of sore throat, fever, exudative tonsillitis, and cervical lymphadenopathy with throat culture showing gram-positive cocci, beta-hemolytic, and bacitracin sensitive is consistent with Streptococcus pyogenes, also group A Streptococcus pharyngitis. This is the most common bacterial cause of pharyngitis and is treated with penicillin or amoxicillin to prevent complications like rheumatic fever. Answer choice A, Arcanobacterium hemolyticum, is incorrect. Arcanobacterium hemolyticum causes pharyngitis with rash in young adults and is beta-hemolytic, but is a gram-positive bacillus, not coccus, and is bacitracin insensitive. Answer choice B, Corynebacterium diphtheriae, is incorrect. Corynebacterium diphtheriae is a gram-positive bacillus forming a pseudomembrane in diphtheria. It is not a coccus or beta-hemolytic and is bacitracin insensitive. Answer choice C, Streptococcus agalacti, is incorrect. Streptococcus agalacti, also known as group B Streptococcus, is beta-hemolytic but bacitracin resistant and causes neonatal sepsis or meningitis, not pharyngitis. Answer choice D, Streptococcus pneumoniae, is incorrect. Streptococcus pneumoniae is alpha-hemolytic and optogen sensitive, causing pneumonia or otitis, not pharyngitis. Key learning point. Streptococcus pyogenes causes bacterial pharyngitis identified by beta-hemolytic bacitracin sensitive gram-positive cocci. A negative rapid test should be followed by culture confirmation. Question 2, Microbiology 34. A 60-year-old man presents to the emergency department with a 5-day history of fever, productive cough with purulent sputum, and right-sided chest pain worsened by breathing. He denies recent travel or sick contacts. Past medical history is significant for type 2 diabetes, which is treated with metformin. Vital signs are temperature of 39 degrees Celsius or 102.2 degrees Fahrenheit, a pulse of 110 beats per minute, respirations of 24 per minute, and blood pressure 104/62. On physical examination, there are crackles in the right lower lobe. Chest X-ray reveals a right lower lobe consolidation with a cavity and air fluid level. Sputum culture grows gram-positive cocci in chains, which are alpha-hemolytic on blood agar and optogen sensitive. Which of the following is the most likely causative organism? Is it A. Klebsiella pneumoniae, B. Mycobacterium tuberculosis, C. Staphylococcus aureus, D. Streptococcus pneumoniae, or E. Streptococcus pyogenes? And the correct answer is D. Streptococcus pneumoniae. This patient has symptoms, signs, and radiologic findings consistent with pneumonia. The sputum cultured growing gram-positive cocci in chains, which are alpha-hemolytic and optogen sensitive, indicate Streptococcus pneumoniae pneumonia. This organism is a common cause of community-acquired pneumonia, occasionally forming cavitary lesions in high-risk patients like those with diabetes. Answer choice A, Klebsiella pneumoniae, is incorrect. Klebsiella pneumoniae is a gram-negative bacillus which causes necrotizing lumbar pneumonia, often with current jelly sputum. It is not a gram-positive coccus or optogen sensitive. Answer choice B, Mycobacterium tuberculosis, is incorrect. Mycobacterium tuberculosis causes chronic cavitary lung disease, often with weight loss and night sweats, and is identified by acid-fast bacilli, not gram-positive cocci or optogen sensitivity. Answer choice C, Staphylococcus aureus, is incorrect. Staphylococcus aureus causes necrotizing pneumonia and is often post-viral. Sputum culture grows gram-positive cocci in clusters, not chains, with beta hemolysis. It is not optogen sensitive. Answer choice E, Streptococcus pyogenes, is incorrect. Streptococcus pyogenes, also known as group A Streptococcus, is beta hemolytic, not alpha hemolytic, and typically causes pharyngitis or skin infections, only rarely causing cavitary pneumonia. Key learning point: Streptococcus pneumoniae is a leading cause of community-acquired pneumonia, identified by gram-positive cocci in chains, alpha hemolysis, and optogen sensitivity. Cavitation is rare but occurs in high-risk patients.
Does it ever feel like you're a marketing professional just speaking into the void? But with LinkedIn ads, you can know you're reaching the right decision makers, a network of 130 million of them, in fact. You can even target buyers by job title, industry, company, seniority, skills, and did I say job title? See how you can avoid the void and reach the right buyers with LinkedIn ads. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started at linkedin.com/campaign. Terms and conditions apply.
Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Question 3, Microbiology 36. A 25-year-old woman presents to the emergency department with a 3-day history of fever, chills, and painful urination. She reports increased urinary frequency and urgency but denies flank pain or vaginal discharge. Her medical history is unremarkable and she is sexually active with one partner. Vital signs are temperature 38.3 degrees Celsius, 100.1 degrees Fahrenheit, pulse 89 beats per minute, and blood pressure 108/65. On physical examination, there is suprapubic tenderness to palpation. Urinalysis shows pyuria and a positive nitrate test. Urine culture grows greater than 10 to the 5th CFU per ml of gram-negative bacilli with a metallic sheen on eosin methylene blue agar. Which of the following is the most likely causative organism? Is it A. Escherichia coli, B. Klebsiella pneumoniae, C. Pseudomonas aeruginosa, D. Proteus mirabilis, or E. Staphylococcus saprophyticus? And the correct answer is A. Escherichia coli. This patient's symptoms of fever, dysuria, frequency, and urgency with pyuria, bacteriuria, and positive nitrates indicate acute uncomplicated cystitis. Urine culture showing gram-negative bacilli with metallic sheen on eosin methylene blue agar points to Escherichia coli, the most common cause of community-acquired urinary tract infections. representing 70 to 95% of cases. Answer choice B, Klebsiella pneumoniae, is incorrect. Klebsiella pneumoniae can cause urinary tract infections, particularly in hospitalized patients, but forms mucoid colonies on the Eosin Midland blue agar without the characteristic metallic sheen of Escherichia coli. It is less common in community settings. Answer choice C, Pseudomonas aeruginosa, is incorrect. Pseudomonas aeruginosa is associated with complicated or hospital-acquired urinary tract infections, showing green pigment on culture and no metallic sheen on Eosin Midland blue agar. It is rare in uncomplicated community-acquired cases. Answer choice D, Proteus mirabilis, is incorrect. Proteus mirabilis causes urinary tract infections with alkaline urine and urease production, but shows swarming motility on agar, not a metallic sheen on Eosin Midland blue agar. Answer choice E, Staphylococcus saprophyticus, is incorrect. Staphylococcus saprophyticus causes urinary tract infections in young women but is a gram-positive coccus and does not grow with a metallic sheen on Eosin Midland blue agar, which is selective for gram-negative bacilli. Key learning point: Escherichia coli is the leading cause of acute uncomplicated cystitis identified by gram-negative bacilli with a metallic sheen on Eosin Midland blue agar. Urinalysis with nitrates and pyuria in culture confirms the diagnosis. And that will conclude this episode of our USMLE Step 1 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 1 questions at medprep2go.com. Happy studying!